And for American Heart Month, we invited Dr. Jay Pandya to join us here on Midday. He is an interventional cardiologist with Heart Hospital Boston at St. David's Round Rock. It's a mouthful.
Yeah.
Welcome to
Thank you.
KVUE News Midday. You know, what are the warning signs for a heart attack and how do they differ between men and women?
Yeah, so classically we've always been taught with men that, the warning signs for a heart attack are some chest pain, heavy chest pressure in the chest. And although that can be true for women as well, what we know now is that women often present with alternative symptoms and signs, things like shoulder pain, upper back pain, sometimes just isolated shortness of breath. So it is trickier sometimes to diagnose heart issues and heart pain with women as compared to men.
Now, those symptoms I feel like I have every day. So at what point does it become significant enough to call 911?
Yeah, that's a tough question. And what we usually will tell patients is just kind of trust yourself, listen to your body. Most of the time what we know talking to patients is they kind of know when something's wrong. Minor aches, minor discomforts can occur and making too much of that can be a problem. But when you know inside that there's something here that's not right, then you should seek treatment.
We're focusing on women because heart disease is the #1 killer of women in the U.S. Why is that? What are the reasons behind that?
There's several, explanations. One is, diet related. One can be some societal changes with, less exercise, more pollution. There's lots of theories out there, but one of the reasons that we think maybe we're simply more aware of it now. Typically in the past, women were underrepresented and understudied in cardiac disease, and now when we pay more attention to them, we're starting to see that they suffer from heart disease just as much as men.
So what should we do? What tests should we advocate for ourselves?
Yeah, there are many different tests that could be considered. What we usually would recommend is starting with an evaluation by a physician, talking to your primary doc, and then possibly getting referred to a cardiologist. And then in that situation, we'll sit down and kind of talk about what would be the right test for you. There are things like calcium scores and stress tests and CTs, and there's a whole host of different tests that can be tailored to the person based on their particular symptoms and risk factor profile.
And so what age should women start maybe having regular heart checkups?
Generally, what we will say is 50 is probably a good age to start seeing somebody to determine your cardiac risk. However, if you have other risk factors that put you at elevated risk, such as a family history of smoking, diabetes, things like that, obesity, exactly. All those things could push you to getting evaluated maybe a little bit sooner.
All right, Dr. Jay Pandya, thank you so much for your time.
Thanks for having me.
Appreciate your advice.